I'm Dr. Paul Carniol, President of the American Academy of Facial Plastic and Reconstructive Surgery, here to discuss the relationship between vaccination with the Moderna vaccine for the COVID pandemic and facial fillers. As you may have heard, facial swelling was reported in 2 patients in the vaccine trial who received the Moderna vaccine. The facial swelling was brief and went away without any residual problems. One of the patients had received facial filler 2 weeks prior to receiving the vaccine. The other patient had received facial filler 6 months prior to the vaccine. It is not reported what filler these patients had, so we do not even know whether there was any residual filler in the patient's face who had the filler placed 6 months before the vaccine. In both of these patients, any facial swelling that developed resolved fairly quickly and without any residual problems. To find out more information about this, I contacted the filler companies. One of the companies reported as follows. Their recommendation now is that for 2 weeks before receiving the vaccine and for 2 weeks after receiving the vaccine, patients should avoid having facial filler. Each patient has to make their own decision. The chance of having a reaction to this facial filler and the vaccine seems to be very small, 0.02%. However, there is still some chance of reaction. Considering this, each individual must make their own decision. As the reaction to facial swelling went away without any problems, this also should be taken into consideration. We are certainly happy to answer any questions you might have about facial filler and swelling after injection with the COVID vaccine by Moderna, period. Please call us if you have any questions at the American Academy of Facial Plastic and Reconstructive Surgery. Thank you. Stay healthy. Be careful out there. Wear a mask and use precautions.